of my greatest fears is to lose this precious gift. I want to make sure that that gift is well cared for. That's all I have. My father was diagnosed with polycystic kidneys in 1984. He eventually went on dialysis. 4 years later, he died from a metabolic imbalance of salt and potassium in his system. He was 68. Myself and my siblings were advised to get tested, so I got tested, and I was also found to have polycystic kidney disease.
He was dealing with trying to make choices about how he was going to deal with the fact that he was going to have complete kidney failure.
The end game is going to be dialysis or transplant. Through blood testing, they looked at my blood samples. White blood cells, your counts should be between 4 and 11. But once that number 11 gets exceeded, then there's cause for concern. And so they did find some abnormal cells and determined it was chronic lymphocytic leukemia, which...
It can be really hard to get a transplant if you have cancer, because at most small transplant units, you're just excluded.
I was expecting not to get a transplant because of leukemia. So that was my mindset.
If you don't fit in to transplantation, there's dialysis. First of all, just dealing with dialysis is a huge effort. It is typically 3 hours, 4 or 5 times a week. A lot of time on a partner's part is a huge stress. It limited his life significantly.
I have a friend who got a kidney transplant, and he has had the same kidney for over 25 years, and the kidney's starting to fail. He says they wouldn't give him a transplant anyway because of his heart, and he doesn't want to go on dialysis again. He's going to just cash in his chips. Having to have no hope beyond just doing dialysis permanently, that would have grown old at some point in time.
There are a lot of cancers now that are basically chronic diseases, and you can survive for a very long time. And he had that kind of disease. His survival was going to be probably much longer from his malignancy than from any treatment we gave him for his kidney disease. So it's silly to think he shouldn't get a kidney transplant. I had contact with the Massachusetts General, a very large program. They're willing to consider things other transplant units won't consider.
Without that phone call and the contact to Mass General, it would never have happened.
It can be a 5 to 8 year wait at this point to get a kidney from somebody who's died. There has to be a real push for living donors at this point.
I had basically 10 volunteers volunteer and all rejected. I always thought that some way I was going to get a transplant and get off this wheel.
We've been friends since the 1970s. 2 years ago, we were skiing. We were in the parking lot saying goodbye to each other, and Louis was very disappointed because his sister, I think, had gone through a ton of testing, and at the very end was rejected.
She asked me what my blood type was. Well, I said, my blood type's like my attitude. It's B positive. And then she says,
"Oh, I'm a B positive. I'll give you a kidney." Because I knew that he would be an amazing recipient. He'd take care of my kidney, and I'm gonna cry.
you're going to change somebody's life, but it's not just one person. It's all the people around that person, their family, their caregivers. It didn't just free me, it freed Nancy. And that's really life-changing.
It's an incredible gift that I never can ever repay.
I carry her with me every minute of every day. So I'm 69, going on to 70.